Are you having a heart attack? And these are common things, common questions that we get at the HeartFit Clinic. My name is Diamond Fernandez. I'm your founder, your author, and director of the HeartFit Clinic here. And what we focus on in our clinic is we would like to see you after that. I mean, we're a cardiac rehab and heart attack and stroke prevention clinic. But are you having a heart attack? Those are the common questions that we have. So I'm going to talk about two things to see if you're having a heart attack. Number one, I had another video talking about symptoms. So if those symptoms, so pain in the chest, jaw, anything kind of like in this kind of region, kind of going a little bit lower in the video here, but anywhere like headache, jaw pain, neck pain, shoulder pain, down the arms, chest, indigestion, pain between the shoulder blades. These are all, if these discomforts manifest itself to a point where you can't tolerate that pain, that's definitely possible. You got to go to the hospital. That's number one. The quicker you get there, the better it is for outcomes for survival as well. So that's very important to understand. So are you having a heart attack? And how do we find out if you're having a heart attack? Number one, you have to have these symptoms. Okay, so that's number one. Number two, we look at your ECG. And so this is where an ECG is valuable. And I'll do another video just on ECGs as well, and the value of it or not being valuable. But ECG, what we're specifically looking for is ST elevation, which then denotes an ST elevation myocardial infarction, which is a heart attack as a result to changes in your electrocardiogram. Now, to keep it simple here, and I got other videos where I talk about that part of it, the heart beats, so there's the top chambers that beat, and then the bottom chambers beat. So basically the heart contracts, and then the heart relaxes. So when you're having a heart attack, and how we can see it on ECG, from when the heart contracts to when it relaxes, it shows up on an ECG. And so it's called ST elevation MI. And so, and I'll show an example of what that looks like here. And so we look at that, but then you could also be having a non-ST elevation MI, which is a heart attack, in my opinion, a little bit less severe, but can be just as dangerous, is basically a heart attack where it's not making any changes to the ECG. And that's called a non-ST elevation MI. In that case, we look at blood work. We look specifically at your cardiac enzymes, so your CK enzymes and your troponins. And if those troponins or CK enzymes are elevated, then that denotes that you're having a heart attack. So those are ways to determine if you're having a heart attack. So again, number one, symptoms. Number two, ECG. And number three, blood work. Now, these types of things are not valuable to do on a preventative basis. So it's not valuable to do, for a preventative side of things. We have to wait till symptoms. Or number two, let me just get an ECG done and I can see if I'm okay. And that's kind of a waste of time, and I'll do another video on that. And number three, doing that same blood work on a preventative thing, complete waste of time. So we're looking at this more, are you having a heart attack? That's the theme of this video. And those are the things that we look at. Symptoms, ECG, and blood work, which is your troponins and CK enzymes. Diamond Fernandez here with the HeartFit Clinic. Look forward to continuing to help you live happier, healthier, and longer.